When we talk about Botox, in this case, we're not talking about anti-aging your vagina.
No.
We're not talking about anti-aging your butthole. Botox, yay or nay, Amanda?
Personally,
you're listening to the Pelvic Freak Show
with your hosts, Amanda Neary and Hannah Meyer. Hey, Pelvic Freaks. Welcome back to another episode of the Pelvic Freak Show.
Where you're freaks for us and we're freaks for your pelvis, baby.
Welcome back. I already said that. We hope you guys are having a great week. It is Thursday again here at the Pelvic Freak Show.
It's just like it keeps being Thursday.
It just is always somehow Thursday.
Every 7 days.
If you guys have been loving our pod, make sure you leave us a rating before you start this episode so you don't forget at the end. It would mean so much to us.
And leave a review and say how much you love this podcast.
Yeah, we love reading your comments and starting a little conversation and building community with you all.
And we share your reviews and your comments on our story.
Yee! Hannah and I, before we turned on the mics today, we were actually just having a conversation and we decided, you know what, we should be having this conversation with the mics on because it's kind of fun. We've been doing stand-up comedy. Is that crazy?
Did it give me a panic attack yesterday? Yes, the answer is yes.
Yeah, but it won't again.
It won't again unless it does.
I don't like
but
that.
I have the tools to work through it. So it'll be fine. Actually, I don't think it'll happen again because the first time is the worst. And that's what they say. We had to prepare 3 minutes of stand-up comedy for our class. And it was our first time ever even trying to write stand-up or perform it. And going forward in this class, we're taking our same stand-up that we wrote and we're just editing it and making it better each time. So it's going to be better going forward.
When I tell you, like, I truly didn't know how I was going to perform my written work, and then when you do it, it's fine. Like, it was such a weird, I've performed in various capacities my whole life, and it was so weird, but it wasn't, when I was up there, it wasn't as nerve-wracking as other types of performance, because it was just me on stage, like, reading something I wrote.
Yeah, it felt like a little natural too. And I'm just like, fuck it if you don't think I'm funny.
I started this class being way more nervous about it than improv last year. And now I like it way more already. Like, I think I like, because I love preparing material. Like, I don't like not knowing what's going on or having to think on the spot. And some of stand-up is that you add in your little ad-libs and whatnot. But for the most part, you're prepped with your jokes. You have stuff memorized that you're excited to talk about. And that's how I wanted improv to be. I would always think about, what role do I want to play tonight? And how do I fit it into this thing I have no control over? And it never worked out.
No, it didn't.
You can't.
It was terrifying.
You can't prep.
I remember like one specific instance in improv where I was the main character for so long and other people kept jumping in. And I was just like, it was so hard. And I still have nightmares about it. Yeah. But it was fine. And stand-up I do like better. It is equally still very hard, however.
It's super hard in a different way. And I like how our teacher said she was going to ruin stand-up for us because now I have a new appreciation for it. I always thought it looked hard and I love stand-up. I genuinely love going. And now I'm just like, you guys are badass for getting up there and doing that.
You know what's funny about mine and Amanda's stand-up? Both of it is about hating on men. Could you guys have guessed that?
I don't think anyone listening is surprised by that.
Yeah, like I think, and I keep talking about hating men in class, and I'm like, it may just be us. I give feedback like, oh yeah, obviously, everyone hates men, but I don't.
Someone else was like, wait, why do bisexuals hate men? And I was like, you
don't get that?
Know that? What do you mean? Of course we do.
I thought that was a known.
So we have to explain our hatred for men a little bit. That's wild.
That's crazy. We're not to you guys.
Oh man.
But you guys already know the men that we love, right?
The good ones. But we were talking about how we went from, I'm never doing this in public, and we were just talking about maybe doing an open mic on Sunday, which is actually insane.
Yeah. If you guys are in Chicago, no, I'm just kidding.
Don't come. Never come. Don't tell them what our showcase is.
No, I don't. I will never do that. Are you kidding me? What if we get really good at it?
I mean, it was fun. I kind of loved it.
Amanda she forces me out of my comfort zone a lot. And I like it a lot, but I also fucking hate it a lot. But it's good.
Yeah, to be clear, I didn't force you.
You didn't force me.
But I inspired you.
You inspired me, and I wouldn't have done it by myself probably.
True.
Maybe way down the road. Mm-hmm. But the fact that you were like, I want to do this, I was like, okay, well then I have to do it.
Yeah, I'm doing it with or without you.
Anyways, that's our stand-up. We'll update you guys if we actually end up liking it even more. But after week 1 of presenting our own stand-up, it was not as bad as we expected. Yeah.
Yay. So this doesn't leeway into what we're talking about today at all, but we just wanted to have an organic conversation about what we were already talking about.
In a way, though, writing our stand-up and everything really does help with our podcast, though. So that's why we wanted to tell you guys.
Yeah, that's why we're doing it.
For you. We're doing it for you.
We're doing it for you. It's cool to learn the structure of a joke and why things are funny and why people laugh at things. Even though this isn't a comedy podcast, obviously Hannah and I are quirky and we have our own way of interacting with each other that we think is funny.
Obviously, we're just really naturally funny and you guys just get to reap the benefits of that. Reap the benefits.
Reap the rewards. Anyway, today we're talking about Botox, but probably not what you're thinking. Botox for the pelvic floor.
Botox for your vagina?
I know.
Question mark?
Yay
exclamation
or nay.
point?
If you clicked on this episode for the title, you might have heard of this already. But for those who don't know, Botox is being prescribed for pelvic floor dysfunction and is FDA approved for treating overactive bladder syndrome. So Botox, which is botulinum toxin A, everyone knows it as the drug that gets rid of your forehead wrinkles, and it's a temporary muscle relaxant, right? I get it myself. I love Botox.
Yeah.
I really do.
When we talk about Botox, in this case, we're not talking about anti-aging your vagina.
No.
We're not talking about anti-aging your butthole. In terms of what it is used for, it can be used to temporarily block nerve signals that cause your muscles in your pelvic floor to contract. So it can help treat a lot of chronic conditions. So vaginismus is one that comes to mind, or just chronic pelvic pain from hypertonic pelvic floor muscles, or even just chronic pelvic floor muscle tension. If it's really hard to get a tampon in, or sex is really painful and it's coming from those tight pelvic floor muscles, you've tried pelvic floor PT and you need a little bit of extra push, sometimes people will seek out Botox. And we're going to talk about some of the research behind that, what we think about Botox, when we think it's appropriate, when it's not, etc.
Mm-hmm. Botox, I'm not actually sure what year they started prescribing it for pelvic health, but when I was a physical therapy student, I worked in a stroke step-down ward, subacute stroke rehab. So post the critical phase, and the patient is medically well, but they might not be able to walk or use their arm or something. So we were rehabbing them, and I would watch Botox injections once every day or once every 2 days for spasticity. So when the muscle tone is so high that they can no longer flex the muscle a certain way, engage it, activate it specifically in the calf, the plantar flexors, and the forearm flexors. And it made the world of a difference for these patients, and it just gave them their life back. And that was the first encounter I ever had with Botox, was in a medical sense. So I've always been for it as a tool in a toolkit for things that it really works for. And now it's been used for migraines, and it can really help with that. And now people are using it for pelvic health. And that's what we want to talk about today, because this is a little bit newer. It's probably under research compared to the other things Botox has been used for medically, but it is FDA approved. So we have patients ask us about it all the time. Should I get Botox? Should I get a nerve block? It's just one of the options that are coming up these days for pain or overactive bladder. So that's why we wanted to get into it with you guys a little bit more.
Yes, agreed.
Do you know when Botox started being used for pelvic health?
I know that when I started as a PT, very first patients that I was seeing, I had some that were already getting Botox injections.
Okay, yeah.
And that was on their routine. And those were for patients dealing with more chronic conditions. And then we'll talk a little bit why it has to be a routine here in a second too.
All right.
What about you? When did you start seeing it?
I mean, same. Back in the States, though, I never saw it in the UK when I was doing any stuff with pelvic health nearby. But I also didn't have a pelvic floor placement specialty, so they might have been doing it there. I'm just not sure.
In PT school, it was always taught in terms of spasticity. And for stroke patients, it was in our neuro classes. We learned so much about Botox.
Yeah.
It was never talked about in terms of pelvic health.
I didn't even learn public health in PT school.
Well, yeah, and we've talked about that.
As you guys know.
Yeah.
So what is the evidence? I briefly looked through some different reviews. Not briefly, I looked at them in detail, but the one that I chose, I was skimming the dates on them and I wanted to pick a recent systematic review. The most recent systematic review I found was from 2021 and the research in it dated as far back as 2018. So we're looking at almost a decade ago research.
That's crazy.
I know.
Shut up.
No, I know.
That's crazy. It's 2026. Oh my God.
Yeah, because 2018 to me, I'm like, oh, that was like last year. Because that's the last time I wrote a systematic review. I was looking at articles from those dates.
That's insane.
So it's just wild to think about. But 2021, it's not recent. It's still like good evidence to look at, but take all of this with a grain of salt because we need more and we need current evidence on what we're actually using Botox for clinically. This was a review done by Meister, Brubacher, Stucliffe, and Lauder, exploring the effects of Botox injected in the pelvic floor on pain as well as some secondary symptoms, including dysmenorrhea, dyspareunia, which they say pain and dyspareunia, so I'm not entirely sure how they differentiate those. Yeah. Quality of life and sexual activity.
I guess dyspareunia is technically pain with sex.
Yeah, or pain with penetration.
Pain with penetration. And I guess just when they're categorizing pain versus dyspareunia, maybe it could just be general pelvic pain, like cramping, not even indicating penetration.
True.
So, and then dysmenorrhea is painful periods.
Yes.
So
they looked at a few other things too, but those are the ones that had impacts. So I just chose to keep those, and the other things tested weren't really significant anyways. They ended up including 9 studies. Their sample sizes were all over the place and their methods were all over the place. So that's why they say this isn't conclusive research, but it gives us the idea of what further research could explore. So all of these studies did find a statistically and clinically significant improvement in pain reduction, peaking at 4 weeks and subsiding beyond that, but 4 through 11 weeks all had positive results. And as we know, Botox is not permanent. It always fades and your muscles will always go back to what they were doing before unless they like change on their own in that time and there's some neurological effect on the muscles and something else happens. It's not going to be from the Botox. It's not permanent. So I thought it was interesting that all of these outcomes were only tested through 12 weeks. We weren't really exploring any long-term impacts about what happens after Botox and what happens after, that fades.
Yeah, but 4 to 11 weeks, what's 11 minus 4? I got to think. 10, 9, 8, 7. It's the end of the day.
7 weeks.
7 weeks of having a good reduction in pain for people that are having chronic pain, painful sex, whatever it is, and it's impacting your daily life because you're not going to seek this out unless it is severely packing. Unless it
severely packing.
Unless it is severely impacting your day to day, or even like ADLs, anything like that. Mm-hmm. So that's not bad.
That's not bad. And their highest level of evidence was with Botox combined with a secondary treatment approach. And one of the examples of that was pelvic floor therapy.
I love when I see pelvic floor physical therapy.
Pelvic floor physical therapy
in research.
In the study.
That's cool.
However, there were some adverse outcomes in all studies ranging from constipation, urinary incontinence, fecal incontinence, cold or flu-like symptoms, urinary retention, GI side effects, UTIs, bleeding complications, pelvic pain, back pain, and vulvar irritation. So that's a lot of side effects, and they're super broad, and none of them are consistent across all studies, but they were all reported at some point in this research with the intervention.
Yeah. And have you seen any of these side effects personally or worked with patients that have gotten Botox and seen side effects like this?
I've seen a few.
I I've seen some people where they're relying more on Botox and it can lead to more fecal incontinence where, yes, it's helping my tension, but I just had an accident.
Right.
And what the heck?
Yeah.
Which makes sense because it's impairing your muscle control in a way. If you're used to hypertension in your pelvic floor muscles, now your pelvic floor muscles are more quote unquote relaxed from the Botox. And now it's going to be harder to maybe contract them and get full control, which that can be the downside of just solely relying on Botox and not understanding the function of your pelvic floor and what's really going on. But not a lot of people will know that immediately from their doctors. Maybe their doctors will immediately present Botox as a first line of treatment, and then it'll work, and then it'll get worse again, but then they'll go back for more Botox, but then they're not treating the underlying symptoms. So it can be seen as a Band-Aid in that sense with some of those side effects that we mentioned before. But when you're doing it alongside pelvic floor PT, can be really beneficial, especially if it helps to get you over that hump, and then you can work on pelvic floor muscle coordination and things like that too.
Yeah, I think our biggest qualm with it as pelvic floor PTs is when it is presented as a first line of treatment or viewed in a way that Botox is viewed for other conditions, right? Because if you're thinking about a stroke or a migraine, someone with chronic migraines, maybe Botox is something that they need regularly every 6 months to just help with their chronic migraines. Maybe it's coming from something that they've tried treating muscularly in so many different ways. But because the pelvic floor is already so undertreated, a lot of people don't go to pelvic floor therapy or think I need to treat these muscles or do something different with the way I function in this area. This isn't like a last resort. My doctor just brought up Botox to me and I didn't know it was going to lead to weakness or incontinence or something. So one, disclosing side effects is super important in any medical procedure, and that should be done. But a lot of times patients don't have the understanding of what could happen in that sense. And two, yeah, it needs to be combined. I would say my advice to any listener: don't do Botox alone for pelvic floor dysfunction. It can be super beneficial. Like you said, 7 weeks of pain relief is huge and life-changing for people, and it totally can be. But it needs to be done in a strategic way.
Yeah. Let me see. If I'm thinking about a patient that would benefit from this, I'm thinking of someone that, let's say, their muscles are so, I'm going to think of just a blanket kind of case where I would see that Botox could be beneficial. Let's think of a person with a vagina. Let's say you've never been able to put a tampon in, for example. You've been going to pelvic floor PT for months and you've seen maybe very little to no improvement. Your muscles are super, super tight and you're feeling very like, what the heck, what do I do next? Then that's when you can start combining these other treatments and they can be beneficial. And then Botox can be helpful to get us over that hump, like I said before, continuing with your pelvic floor PT treatment, progressing with whatever it is, dilators, wand, whatever your PT is suggesting, the internal work, your exercises, stretches, and then hopefully once that Botox wears off, you could have made some progress on your own already, or maybe you will need to go through more rounds of Botox. That's something that's common too.
Yeah. And if you're thinking about the way, so take someone who has vaginismus, for an example, which is basically an example of not being able to use a tampon, right? You insert and it maybe feels like you're hitting a wall. You can't insert anything into the vagina. Typically it's with sexual activity, but it could be with your finger or something too. Let's say those muscles are forcefully relaxed with Botox, and then you're doing pelvic floor therapy. You're rebuilding neural pathways for safety in the body. So if you're doing that for 12 weeks straight, I would imagine they would see an improvement in the muscle in like this hypothetical patient we're discussing. And we've seen this in real people, but it makes sense that if you're keeping consistent with an intervention while you have pain relief, this is what we do all the time. We see people post-op, they're taking pain relief, and we make progress while they can move easily and they're experiencing pain relief. So it makes sense that that would be beneficial.
Yeah, I could see it being beneficial for if you have a very hypertonic pelvic floor and you can't feel what it's like to relax your pelvic floor, you can't Kegel, it just feels like your muscles are frozen in the space-time continuum. Whoa.
Space-time continuum.
Yeah. Then Botox could be helpful in even just trying to find that coordination, and your body's like, whoa, this is what it feels like for my muscles to move a little bit. That could be helpful.
Yeah, totally. This study did talk about some limitations, which I already mentioned, the amount of studies and the sample sizes and the testing in all different ways. So some used a placebo control, which is no medication, and some used an active control, a nerve block, which we'll talk about in a second. And all studies injected into various muscle groups. So some were the same, but they weren't standardized. So some were levator ani, some were just a specific trigger point and just following the trigger point, injecting there in the pelvic floor. So, but to me, that's almost even more impressive that every study found reductions, and they were all like doing it a different way, and there were only 9 of them. But yeah, statistic and clinical significant differences in pain scores. Secondary clinically different scores were for dyspareunia, quality of life, and dysesthesia. I don't call anything dysesthesia.
I never say dysesthesia. When I saw that written out, I said, God bless you.
Literally.
Did you sneeze?
That's really funny.
Thanks. I've been taking stand-up classes.
Yeah, that's crazy. Basically, that's like sphincter malfunction, right? Sphincter spasticity.
Yeah.
So it can help with basically that bowel symptom, but as we know, you have your side effect possibilities of fecal and bladder weakness with that, which might be a very worthwhile trade-off if severe pain is occurring or something else is happening and you're willing to have that side effect for a short term.
Yeah, like if it is the side effect that occurs, it's going to wear off eventually because Botox isn't long lasting.
Yeah, you ever got Botox in the wrong smile lines and then had a crooked smile? I haven't because my injector is perfect, but I have seen people do it and they just laugh it off. They're like, this will be gone in 3 months. Obviously, it's a little different with a bodily dysfunction.
It is. I've actually never gotten Botox.
That's not surprising. You're 27.
I hate when I say gotten. I've never gotten Botox. I've never had Botox.
Yeah. Don't start till you feel like it. Don't do it if you don't want to.
And I will if I want.
Yeah.
But also, who would not be good for Botox? For pelvic floor specifically.
Okay. Here's an analogy. So something I can relate this to as someone who treated an ortho for a while is someone who comes to me with knee pain and says, should I get a knee replacement? But they don't rehab their knee. They don't do exercises. They don't want to do exercises. They're seeing surgery as the thing that will be a cure-all and then they'll be back to normal. That is almost never, actually just never the reality. A surgery is always going to need work after to work well and to work long-term and get the result that you're looking for, whether that's rehab or getting into a consistent fitness routine that works the muscles around that area, because you're going to have degeneration and things like that. So I'm getting a little more philosophical with it, but anyone who only wants to use Botox for improvement, I would say should not do it without trying a conservative approach first.
Yeah, I would agree. In my professional opinion, putting in the work, learning about your body, and doing the physical therapy is going to be the most helpful. These are things, in my professional opinion, as a physical therapist, so I'm a little biased, PT doesn't hurt no matter what. It's not going to make things worse. So you might as well try that. This does come with side effects. So I would use it as a second line approach, maybe to add into my PT if I need an extra little boost. It is a needle. It's an injection. I wouldn't recommend it to anyone that is afraid of needles for sure. I wouldn't say that it's something you have to do, especially if you are afraid of needles or injections in general. And you're like, oh, my doctor recommended Botox. Now I have to do Botox. I have to get a needle put where? What? That's not something you have to do. This is just an option to add into your care that you can ask your PT about, that you can ask your collaboration of care of providers about on your journey of pelvic floor muscle tension that we know all too well.
Yeah. And if you're someone that struggles with chronic pelvic pain and this is something you're considering and listening to this episode to learn more about, consider the fact that it's not permanent. You need to keep getting it if you want it to stay effective. It can be expensive. Sometimes it's covered, but sometimes you need to pay your deductible and it is still expensive for how many units you would need. I would say view it like you would view a steroid injection for an achy joint. You don't want to continue to get it forever, right? So see it as a tool in your toolkit to help you get there. But what is really going to make the long-term change, and it's working on the muscles and coordination and engagement and relaxation, and that you can all do with your pelvic floor therapist while the Botox is working. Yeah. Any conditions you would say, nah, I wouldn't go get Botox?
I would say specifically if it's recommended from your physician, or if your PT might suggest it, to ask your physician, right? If they're looking at your plan of care and you've made it a certain ways through and you're like, what else can I do? Your PT may recommend this. There's different things too, other than Botox. There's trigger point injections that you might hear along your PT journey, which is very different. That's going to be more immediate potential pain relief. It's also not long lasting. It's also temporary. That will be done alongside pelvic floor PT. And if you guys want more information on what trigger point injections are, drop it in the comments. Let us know, because we can do a little spiel on trigger point injections as well.
Well, and just briefly, trigger point injections are sometimes used with Botox, because Botox also can take up to a few weeks to work. So especially depending on how many units and in what muscle, maybe you see some effects in days, but if your pain is severe and chronic and you're looking for a short-term fix, they might throw a nerve block in as well to really help with the symptoms before the Botox kicks in. And also nerve blocks are often used like diagnostically if you're trying to find where the pain's coming from. Botox is a little bit harder to target that specific in a diagnostic way, because it can diffuse into other muscle groups around it. That's why they say like sit up for a few hours after you get Botox in your forehead so it doesn't spread around.
Oh, see, I didn't know that.
Yeah, so they probably wouldn't use it in that way because you're not able to target it the same way you would with a nerve block. So that's maybe one of the reasons that they might do one or the other, you know?
Yeah. So guys, have you done Botox? Have you tried Botox for your pelvic floor? Are you considering trying Botox for your pelvic floor? We have enough pelvic freaks listening right now. One of our goals is to start more of a community. We eventually want to have a community space of pelvic freaks. So if you have tried Botox, it worked for you, it didn't work for you, feel free to comment, feel free to email in, say your opinion, how things went for you and your plan of care, if it helped, if it didn't help, and we can start the conversation a little bit more, because this only helps other people seeking out the same care. Like I'm imagining like a Reddit, you know what I mean? Like where people can come to this episode and look at Botox as a treatment and see what other people's experiences were, and kind of have a community of people that have had pelvic pain or are navigating this realm.
Guys, pelvic pain is not one size fits all. We want to hear your experience with these things too, because again, the purpose of our podcast is to destigmatize these things. It's not taboo to get Botox if it really worked for you and it helped you in your journey. We want to approach it in an evidence-based way and share what the evidence is with you guys so we can give our clinical recommendations, but we're not giving individual medical advice on this podcast. We're here for a discussion, so we definitely want to hear from you.
Botox, yay or nay, Amanda?
Personally, yay.
Personally, yay. I'm not mad about it.
I'm not mad about it.
If I had to give a straight up yay or nay, I'd say yay, but you guys already know we say it depends on your situation.
It depends.
If you're relying solely on Botox, it might not work.
Yeah.
It's not a one fix all, just like dry needling in a way. Like a lot of people rely on dry needling and think like, oh, I'll get my cod needle and I won't have knee pain. It can help, but if you don't do the work, that's not going to stay away.
Yeah.
So you got to you got to put the work in. All right.
Absolutely.
Hope that helps.
I can't actually say that without like hearing a sassy TikTok comment in my head anymore. Like,
what?
Hope this helps.
I hope this helps.
People are like being assholes to each other online. There's just certain things that the internet has ruined. And I think hope this helps is one of them.
Well, guys, I really hope this helps.
It sounds even worse now.
Do you like that we've been giving you guys more research? I hope so.
yeah, let us know. Again, we are making this podcast for all of us. So
we have big plans. We have big news. We have big things coming.
We have really big stuff coming. We're really excited.
No, like we're really excited that you guys don't understand how excited we are.
Yeah, we're actually so excited. We can't tell you any more. We're going to have to end this episode, but make sure you're following us at The Pelvic Freak Show on social media. And you can submit a story at the link in our bio there.
Have you guys bought your Pelvic Freak merch yet?
Oh, it's so good.
Did you buy your sexy little tank top yet?
Yeah, get your Pelvic Freak shirt.
Buy your Pelvic Freak shirt already and send us a picture of you in it so we can share it on our Instagram story.
It's like really, really good.
We really need you guys to buy it. Our goal this year is to start a community, maybe start a community page for all of us to yap and chat all things sex, bodies, health, whatever we need. Mm-hmm. All right?
All right.
Bye, Pelvic Freaks.
Bye, Pelvic Freaks.